Hi, good evening to one and all. I am Dr. Asheesh Malhotra. I am Senior Consultant Nephrologist working at Metro Hospital, Faridabad. We have gathered here to discuss the topic of understanding a very common disease, chronic kidney disease, its symptoms, and what the patient should not ignore having this disease. So let's discuss what is actually chronic kidney disease. Chronic kidney disease has now gained a lot of prevalence in our society with a total amount of 11% worldwide, and while in Indian population it's around 15%. So, if we define chronic kidney disease includes a disease wherein the glomerular filtration rate, which is the functional capacity of kidney, it decreases to less than 16 ml per minute, 60 ml per minute, and this stays for a period of more than 3 months. Associated with it, there are urinary abnormalities. For example, there is protein in urine, RBCs in urine, sediments or cast in urine. There is electrolyte abnormalities. There is ultrasonographic evidence of chronic kidney disease. One kidney is small, or there is bilateral kidneys are small, raised echogenicity. There is histological evidence or biopsy findings of chronic kidney disease, or a patient who is post transplant. So these are the features that will make a person being labeled as having chronic kidney disease. And all these changes, if they stay for a period of more than 3 months, then the person is said to have chronic kidney disease. So now let's discuss what are the features or what are the risk factors that make a patient or a person more prone to develop this disease. This include genetic factors, wherein certain diseases are inherited from one generation to other, like cystic kidney disease, glomerular diseases. Then family history of diabetes mellitus, hypertension, which make a person more prone to develop chronic kidney disease. And this is probably one of the most important and major factor, especially diabetes mellitus, which has grown to large amount and large numbers in current society with the lifestyle, including stress related factors, the eating habits, consumption of alcohol, smoking, and all these factors have made people prone to develop diabetes and hypertension, and therefore have secondary complications, including diseases like chronic kidney disease. Then the other risk factors are personal risk factors, which include consumption of NSAIDs, which are painkillers, or consumption of alternative medications, herbal remedies, the features of obstructive diseases, for example, prostatic enlargement, recurrent UTIs. These are all risk factors for developing chronic kidney disease. If we talk about what are the symptoms, or what a patient of chronic kidney disease, or what in general people should know, if they are having these symptoms, they should get their kidney function test done. These include, in early stages, majority of the patients or majority of the symptoms are benign. They may be, the disease may be diagnosed incidentally while you are being evaluated for another disease, and this chronic kidney disease or kidney problem remains occult. For example, if you are getting evaluated with an ultrasound for some other illness, if you are getting your routine blood test done, and you may find that your creatinine is elevated, and the detailed evaluation will find that it's a chronic kidney problem. Or you may have symptoms which generally develop in the later stages and not in very early stages, because in early stages the body tries to compensate for all the abnormalities, including electrolyte abnormalities, the acid base abnormalities that occur. So in early stages the body tries to compensate, and it is only in the later stages when the symptoms usually occur. So this is also an important factor, because many of the patients who come to our OPD clinics claim that I don't have any symptoms. I feel healthy. I feel I am passing adequate urine. I don't have any swelling. And how come I have a kidney disease? So we need to tell them that it's and we should also make our listeners aware that it is only in the later stages of this illness do the symptoms appear. So, what are the symptoms actually? The symptoms are fatigue, generalized weakness. The symptoms may be vague, or in very later stages may be specific. For example, in early stages, patient may have just generalized weakness. He may have fatigue, exertional dyspnea. He may have itching. He may have nausea, vomiting. He may have taste disturbance. He may have dyspnea, that is breathlessness. His urine output may become decreased. He may have swelling. He may notice that there is frothing in the urine or there is blood in urine. He may have nocturia, that is increased nocturnal frequency of urination. He may notice that there is orthopnea. So these are all the symptoms of kidney problem, and he may also see that there is passage of certain sediments in the urine. Okay, so these are all. He may have bilateral loin pain or lumbar pain. Now, these are all symptoms of kidney disease, and if the patient is having such symptoms, he should get his evaluation done early. Now, if we talk about what are the management, what are the evaluation factors in evaluation A, we need to understand that patients who are at increased risk for having chronic kidney disease, for example, A, if he is having a family history of diabetes, hypertension, or a family member having chronic kidney disease, or a family member who's already on dialysis, such patients should get his evaluation, his routine test for kidney done surely on an annual basis. Or if the risk factors are more, then at least 6 monthly evaluation should be done. Otherwise, at least an annual evaluation should be done for sure, and so that the disease can be picked up in the early stages itself. The other thing is uh, the management aspects is divided into two: a prevention and then the treatment per se. For prevention, uh, early evaluation so that as we've discussed, the disease can be picked up in the early stages. A second thing is the symptoms can be managed in the early stages, and the disease progression can be reduced so that the patient may have a better quality of life, and he may continue to enjoy his daily activities without getting bogged down or getting too symptomatic because of the illness itself. The third thing for prevention or for the management is we can adjust the treatment plan in the early stages, because as the disease progress and there are advanced stages, the treatment options also reduce. But in the early stages there are so many medications that we can employ so that the disease does not progress. The fourth thing is to manage the complications, and the last stage is treatment or planning for the advanced stages. Now, if we talk about the specific treatment includes management for the urinary abnormalities. If there are proteinuria, if there is protein in the urine, we have medications which include ACE inhibitors, angiotensin receptor blockers, or certain other medications like SGLT2 inhibitors, which help in decreasing the extent of protein that is excreted in the urine. If there is hematuria, if there is cast, if there is pus cells, then we have antibiotics and supportive medications to tackle for that. Then the second aspect is management of the anemia which occurs in chronic kidney disease, include for which iron supplements and erythropoietin is used. Management of electrolyte abnormalities, hyperkalemia. Management of acid-based abnormalities, including acidosis. Management for planning for the end stage diseases, end stage the fifth stage, which include access formation, which is a temporary or a permanent access, fistula formation, and guiding and counseling the patient for need for renal replacement therapy. The renal replacement therapy can be in the form of peritoneal dialysis, hemodialysis, or kidney transplantation. And lastly, one last aspect that remains is the stages of chronic kidney disease. The chronic kidney disease has been divided into five stages as per the glomerular filtration rate. From 90 or above is stage 1, 60 to 89 stage 2, 45 to 59 is 3A, from 30 to 44 is stage 3B, 50 to 29 is stage 4, and less than 15 is stage 5. So these are the stages of chronic kidney disease. As far as the highlights point or key point or keynotes for this discussion would be: A, what is the definition of chronic kidney disease? So a GFR of less than equal to 60 for more than 30 for more than 3 months, having urinary abnormalities, histological evidence, ultrasonographic evidence, or post transplant patient is CKD. There are five stages as we have discussed. Then, as far as the prevalence is concerned, it's around 11 to 15%. Major risk factors are diabetes and hypertension, and genetic and hereditary risk factors. Major symptoms are vague, and they do appear only in the later stages, varying from fatigue, exertional dyspnea to breathlessness and pedal edema and decreased urine output. The treatment or diagnosis is by doing your kidney function test, measurement of your urea, creatinine, sodium, potassium, ultrasound, and if required, in few diseases, getting your biopsy done. Treatment include management of urinary abnormalities, metabolic abnormalities, anemia, electrolyte disturbances, and the planning for renal replacement therapy. And also controlling the underlying factors including sugar control for diabetes, blood pressure control, dietary modification. Diet is an important factor wherein you consume a particular protein, particular calories, and salt restricted diet. So these are also an aspect. Treatment for calcium bone mineral density disorders, mineral bone diseases, phosphorus, vitamin D supplementation, and the PTH related diseases. So yeah, so in general, this is what chronic kidney disease encompasses. Thank you.